Unicef officials in Mozambique remain hard at work following the destruction caused by cyclones Idai and Kenneth. The situation has moved from an emergency to a resettlement phase. That's as people rebuild in new locations. Now, Unicef has been helping with healthcare, nutrition, education, water and sanitation and child protection services. Let's get the latest on what's happening there. We're joined via Skype by Unicef Mozambique's Chief of Communication, Daniel Time. Daniel, good morning and thanks for your time. So we understand that they've moved from an emergency to a resettlement phase. What does this phase entail?
Yeah, just to give you an example, I just came back from Beira yesterday and I met a family who has been displaced from Buzi, which is the most heavily affected area, which was underwater 8 meters, and everything has been destroyed. So they've been passing the last 10 weeks in an emergency shelter in the city of Beira. And now they have been assigned a plot about 1 hour drive west of Beira in a little town called Mutua, and they are arriving there and there's nothing but a field. So our role as Unicef and other aid agencies is to provide basic services there. They need water, they need medical services, they need food, and obviously first they need shelter until they have constructed their own houses there.
Okay, so what is the progress of this phase at the moment? Is it still not moving fast enough, or do you think that it's reasonable given the conditions at the moment?
No, I think the progress is reasonable, but we have to make sure that the people who are being resettled are resettled into places where we can already be ready to provide basic services. Nobody can live in a place without drinking water, and nobody can live in a place without medical care in these conditions. The situation right now is that we will be continuing to provide these services, and children go to school in tents, for example. But this can go on for a few weeks, maybe months. But then we have to see that we create structures there that are permanent. And so schools will have to be constructed and health centers will have to be constructed, and in a better way so that they can resist future cyclones. And now we have a donor conference that is discussing these issues, because a lot of funding will be needed for the reconstruction phase after these 2 cyclones.
Daniel, give us some idea of what's happening in terms of illnesses or diseases. Cholera was a big problem at the time, or in the weeks after these cyclones hit. What progress is being made in treating patients or getting rid of these diseases, clearing up?
Yeah, after both cyclones that hit Mozambique, the cholera broke out, and because of the standing waters, it's the ideal breeding ground. It's a disease transmitted by water and contaminated food. So in the central part of Mozambique, we were able to reestablish the water system in the city of Beira, for example, very quickly, and vaccinate about 900,000 people, a major effort, and that contained the disease. And now we are seeing the same thing in the north of Mozambique, in Cabo Delgado province, only 6 weeks later. So we are at the moment vaccinating the population there. And there's big challenges also, because it's always a problem of communication. We have to teach the population why it is so important to get vaccinated. And as you know, it's a mostly Muslim province up there, and we have the holy months of Ramadan, and so we are working together with the religious authorities who in the mosque preach and teach the population that after breaking the fast in the evening, after the iftar, we can go ahead and take these oral vaccinations. So it's always also a very broad communication campaign, which is not always easy, as you can see.
Now I see here, Daniel, that Unicef is also helping with child protection services. Just give us some idea of what's happening there. Are we seeing that a lot of kids have been left orphaned, or are we seeing that parents are still missing, unaccounted for, that kids are in the care of authorities?
Yeah, in the first phase, there were many children separated from their parents, but this was rather due to the nature of the rescue operations, because the rescue teams, for good reasons, first rescue children. And in this chaotic situation, many got separated, and luckily I can say that most of them have been reunited with their parents, but there are children who indeed have lost their parents or whose parents haven't been found yet. And so we have a referral system, and UNICEF with partners takes care of these children. They have special needs of protection, as you can imagine, as do other children have in these kind of situations too. Whenever a humanitarian disaster strikes, there is a situation which is not very easy to grasp and a bit chaotic, and especially children, but also women are very vulnerable to abuse and exploitation. And so we're taking care of these children in safe spaces where we can monitor if there's problems of abuse or other problems also.
Thanks very much for that update there. That's UNICEF Mozambique's Chief of Communication, Daniel Timmy, just giving us an update. Progress is being made, but the people in Mozambique affected by those cyclones Idai and Kenneth still in need of much more.